Hello, and welcome to this program looking at exam study tips and tricks. Congratulations on completing or coming close to completing your Psychiatric Mental Health Nurse Practitioner program. The next step is a certification exam, and we're going to talk about some different things that you can do that may help you in studying and preparing for it. My name is Dr. Sattaria Dilks. I have been teaching psychiatric nurse practitioners since about 2005. I got my BSN from West Texas State. I'm also a counselor. I'm an LPC, licensed professional counselor, in addition to being a psychiatric nurse practitioner. My doctorate is from the University of Tennessee Health Science Center. So this lets you know that I have a little bit of experience in preparing people to take this test. So I want to welcome you again to this exam study tips video. We have over 1,000 multiple choice questions that were prepared by certified psychiatric mental health nurse practitioners, and that is set up in the same manner as the tests that you will be taking. We are dedicated to making this the best study review it can be for you, and we want you to provide feedback if you find some things that you think we could do better. So we're going to talk about the tips and tricks to prepare for your ANCC exam. I've divided this into 3 sections. The test itself, talking about how the questions are set up, how you might go about preparing for the test, and what you should do on the day of the test. So the first thing to look at is to go on the ANCC site and look at the test content outline and the different domains. The biggest thing with this is to remember that you've got to go back to some of those courses you took at the beginning of your nurse practitioner journey, the advanced psychopharmacology, advanced physical assessment, and advanced patho. And so it's going to be more than just psych, because the people that we treat are more than just psych. Definitely going to be some psychopharmacology and neurology related to not only the medications but also the disease states, and genomics that will be thrown in there as well. There will be a few questions on health assessment and health promotion that hopefully you'll be able to consider. Things like, if you get somebody that comes in to see you, when do they need to have a flu shot? When do they need to get a shot for pneumonia? Those types of things are things that we can do as psychiatric nurse practitioners and help our patients. There will also be things on psychiatric emergencies, and it will be generalized. So you might do something for commitment in your state, and the state right next door to you is very different in how they handle it. So the test is generalized. It will be, at what point do you think you need to initiate or figure out how to initiate psychiatric emergencies? The screening tools, look at the ones that are listed on the test and know the cutoff points, when it's going to tell you that there is severe depression on the Beck Depression Inventory, for instance. Or if you do a PHQ-9 and they put that they're suicidal at a level 3, that is going to be the area that you need to focus on. There are going to be questions on diagnoses, both and complementary and alternative treatment type things, as well as pharmacological treatment. Also knowing the different differentials. With the labs, there are a few things you need to know what the levels are. Primarily lithium, what is a toxic level for lithium, and what is a therapeutic level for lithium. There may be a few other labs thrown in there, some liver function studies, some thyroid type of things that we pay attention to, and also look how you differentiate metabolic syndrome type things. They construct these questions around evidence-based practice. So if you look at their list of references, every question that they have can be answered in those references. There probably will be some drug-drug interactions, so know a little bit about cytochrome P450 and how that interacts with the medications that we take. Maybe some of the cancer drugs, some of the things that are out there, HIV treatment maybe, and how they might interact with our medications that we prescribe. There will be something on there for psychotherapy. Know the developmental theories. They are for sure going to be on there. There's going to be some things with trauma-informed care, motivational interviewing, and different types of family psychotherapy. The ethical and legal principles calls back to mind your research courses that you took. You're probably going to see primary, secondary, and tertiary interventions. You might see research. It's also going to incorporate the patient's Bill of Rights, your scope and standards, so go back and review those a little bit. When do you refer to a physician? So it's a matter for you to look at the ethical end of it. And also some of the spiritual and cultural implications, as well as quality improvement initiatives. How are you going to improve your practice? And so that's sort of how the test questions will be set up. Test details. Again, all of the questions can be found in the listed reference material. Does that mean you need to go get it? Absolutely not. You just need to be aware of what a beginning psychiatric nurse practitioner would need to do. Your test is going to be 175 questions over 4 hours. And if you calculate that out, that's a little less than a minute, 1.4 minutes per question. So when you're practicing your test, it would be a good idea to try to make sure that you set up how many questions you're going to do and what the time on that would be, with 1.4 minutes per question. So let's talk about how you can prepare for the test, because that's one of the things I see my students getting really tense about. I want to make sure that I can go in there and pass it, and certainly that's what your instructors want you to do too. So the recommendation is to start early. I recommend that students in their last semester begin to study or go to a sort of review course and figure out what they're going to do. You need to figure out what your areas of weaknesses are as well. How do you study? How do you learn? Do you learn better with somebody else that you can throw questions back and forth to? Do you learn better by yourself? Do you learn better in a group? Those types of things are personal, and you have to figure out what is going to work best for you. And the pace of it. Are you one of those people that you cram at the last minute? Are you somebody that needs to do a steady study habit? Again, decide how many questions you want to answer, set the timer. One of the things I want to talk about too is state-dependent learning. You're going to be in a computer lab. You're going to have really literally nothing around you. And you're not allowed to talk to other people. They're watching how you answer your questions. So the closer you can get to creating that environment, the better chance you're going to have of dealing with the test itself when you get to it. Practice questions. That's one of the best things you can do. Lots and lots of practice questions. We have 1,000 for you to take a look at. Identify your areas of weakness. And for me, I like mnemonics to help me remember things. So that might be something that you want to study. I would not study days at a time, maybe a few hours, or that you're going to study 3 times a week for 3 hours, that type of time. So make a schedule and stick to it. While you're studying, it's really important that you have time off between your study sessions and relax. Make sure that you're eating well, make sure you're hydrating well, sleep. This was an interesting thing I found when I was researching this. If you have anxiety when you test, think about adopting an anxiety management plan. So I've had students that said, okay, well, I'm studying for this test and I'm going to use a beta blocker when I go take the test. It'll slow my heart rate down. It'll help with managing it. So make sure if you're going to do something like that, that you study with it at least part of the time, because that will create the state-dependent learning. There are also a lot of online resources to help you with stress management. You're going to have restrictions in terms of what you can bring in. So think of deep breathing exercises, think of positive thoughts that you are ready for this. I can guarantee you that your faculty did the best they possibly could to get you ready to take this test. So let's look at the questions themselves. Answer only what's asked. Don't project. I have a tendency to go quickly through tests, and I probably skim through the questions sometimes, and I'm not really paying attention to what is being asked. I'm paying attention to what I think they're asking. So be careful of that if you're one of those people. Be wary of words like always, never, most, best, none, not, often, or generally. That gives you an idea of what the answer might be, because if there's something like always, somebody's got a lithium level of 2.0, you're always going to hold the lithium for a little bit. That might be part of what they're looking at. Don't spend too much time on any one question when you're actually taking the test. Break apart the questions. What is being asked? A patient with bipolar disorder always has is very different from a patient with bipolar disorder often has. Most of the things in the question have meaning. They have time frames. They have symptoms. Gender may enter into it, age may enter into it, but not necessarily always. I was on a test content expert panel once where we put together a similar test to what you're going to be taking. So let's look at a question. A 60-year-old man with a history of colon cancer is planned to undergo surgery. The nurse practitioner, instead of just nurse, visits the patient a day before surgery to explain to him the procedure and what the after effects are going to be and help answer any concerns that the patient has. During the conversation, the nurse practitioner notices that the patient starts staring at an empty corner of the wall every few minutes, and he has to be redirected. The patient is noted to be mildly diaphoretic. So what is the best intervention at this moment? Offer to continue the conversation at another time. Ask the patient if he would like the presence of his wife. Offer the patient diazepam, or ask him to take a few deep breaths for a few seconds. So, what were the important indicators in the previous question? This guy had a history of colon cancer with planned surgery. His gender didn't really enter into it. His age, maybe. He's staring in the corner. He needs to be redirected. He's sweating. So what's going on with him is likely anxiety. The question asks you, what is the best intervention at this moment in time? So, answers. If we look at the first one, having the conversation at another time might seem reasonable to some people, but it doesn't address what's going on right now with the patient. Ask the patient if he would like the presence of his wife. That also might be reasonable at some point in time, but again, that doesn't help you right now. Offer the patient diazepam. Well, maybe, but we generally know that benzos are not indicated for moderate anxiety, and that's really what we're seeing. He's not in a panic state. Asking the patient to take slow, deep breaths for a few seconds addresses the moderate anxiety at this moment in time. So hopefully that makes sense to you. So when you're looking at something that asks you what is the best thing to do right now, all of the answers are going to look reasonable, at least at some level. So let's look at the answers that you're going to do with this test. Skip the questions that you don't know the answers to, or you find too difficult, or you're getting bogged down in them, and go back to them later when you have a little more time. If you look at a question and you know the answer before looking at the choices, pick it and move on. If you look at the question and you're thinking, I don't absolutely know it, try to figure out what it might be before you look at the choices. They all have 4 choices. Eliminate any of the wrong answers that are there. In the previous question, really not, there were things that could be okay, all of them. So none of them were definitely wrong. But what was wrong was the time frame and looking at what kind of anxiety was being exhibited. Match the tense of the question to the answer. So answers ending in ing versus those ending in ed. So it needs to match what the question says. Treat each answer as if they're true-false. If you know it's not true, then you can eliminate it. If there are two similar answers, and sometimes there are, focus on the concepts and what is being asked. What do they want out of you for that? So one of the things to think about is, what strategy are you going to employ for unknown answers? Do you want to look at it for a little bit and then save it and go on? One of the cool things about ANCC's test is that there are no penalties for guessing on the test. Answer all of them. Don't overanalyze it. And I find that psych people do this because we tend to think in grays rather than black and white. And it's kind of like, well, you know, you might do this at some point in time when the question is answering what should you always do. And don't get distracted by patterns. There are, you know, when we were in high school, you sort of looked for, if you had 3 C's in a row, you started getting a little anxious about it. So some of the myths are the longest answer. That's not always true, and I can tell you ANCC looks at the lengths of the answers. And if there's a long answer, they try to make sure there's 2 long answers in there. Ignoring always guess B or C when in doubt. Use your critical thinking. You should be able to eliminate 1 or 2 of the answers pretty quickly. And this one really surprised me when I was researching this. The research indicates that, contrary to popular belief, and I believed it till I read this, if you change your answer, you are 3 times more likely to change it from a wrong answer to a right answer. So don't be concerned if you think you need to go back and change it. Sometimes as you're going through the test, there are other questions that will think, oh yeah, that I answered that other one wrong. I need to go back and fix it, because it guides you into particular areas that you're thinking of. So let's look at a few more questions just to kind of take it apart a bit. A 55-year-old man presents to the emergency department and he's acutely intoxicated. Which of the following lab studies is most specific in detecting chronic alcohol use? So there are a few words in there that are important to know. 55, going to have some liver damage if he's been chronically intoxicated, and he uses alcohol on a chronic basis. So we've got a choice between a blood alcohol level, mean corpuscular volume. I'm not even going to try these other 2, AST and GGT. So which one is the most specific in detecting chronic alcohol use? So we can see in this slide it tells us that the correct answer for this particular question is D. You will get an answer explanation for all of the test questions to help you understand what the pathophysiology or the thought process is behind each question. So let's look at another one. You've worked in juvenile justice corrections for 5 years and you're supervising a new provider. After 6 months of supervision, which of the following would cause concern regarding the possibility of her violating boundaries with an inmate? She maintains standards of care and follows protocol for all inmates. She schedules more frequent appointments that appear to be needed with one inmate. She discloses information to inmates such as liking ice cream and having 2 dogs. She is particularly apprehensive about assessing one inmate after he made an inappropriate comment. So the correct answer here is B, scheduling more frequent appointments than appear to be needed. Again, this tells you what the thought process is behind that. She needs to do appointments that are proportionate to the other inmates. If she selects one, then unless there's a reason for it, like the guy's grossly psychotic or something, she is really violating her boundaries and having too much contact. So this one, you are asked to speak about suicide prevention as part of a mental health awareness program for students at the local high school. Which of the following social determinants of health does this program address? Is this educational? Is this enhancing social learning? Does it create social determinant in the neighborhood and environment, or does it add to economic stability? We know that all of these can be social determinants of health. The correct answer is A. You are educating the students for health promotion. So this is an example of one of the health promotion questions that you may see. So this question, a 9-year-old girl is brought to the psychiatric clinic because she's having meltdowns, outbursts, and irritability at school. The parents tell you that she's had these symptoms for the past 3 years at home, which has caused a lot of disruption in the family. Her outbursts have caused her peers to avoid her. They don't want to be around her, and so the teacher has isolated her during class. When the nurse practitioner talks to her about her behavior, she begins to react to the nurse practitioner in an aggressive manner and begins to yell at the top of her voice. The patient's mother denies any significant past medical history for the patient, but notes a history of paternal psychiatric illness. Which of the following disorders does the patient's father have that is most likely correlated with the patient's condition and diagnosis? Familial Alzheimer's, autistic spectrum disorder, ADHD, or schizophrenia. So the correct answer is attention deficit hyperactivity disorder. And this explains because the patient most likely has a disruptive mood dysregulation disorder. So she's got the outbursts in 2 settings for a period of at least a year, and that clarifies the particular diagnosis. We know that there is familial connections from a genetic standpoint on many of the diseases. So a parental history of ADHD, depression, and anxiety are the most common disorders that will contribute to mood dysregulation. Schizophrenia, Alzheimer's, autism don't necessarily connect with disruptive mood disorder.